Welcome to another edition of Ask the Experts. My name's Maree Cameron. I'm a host on the Triple M network and also an ambassador with Endometriosis Australia and part of the 1 in 9 EndoWarriors that we have here in Australia. Now, marching to Endo, or our Endo Awareness Month, is a little bit different this year given all the restrictions that are happening in different places throughout Australia. So we thought, why not bring the experts to you? And thankfully we've had so many people send through their questions along the way. If you ever need any details or you want to reach out for some help, or more importantly donate, because every single dollar is well spent in research and helping to look after all of the endo warriors throughout Australia, you can go to endometriosisaustralia.org. Now, today's Ask the Experts is an incredible one, and I'd say the one that we got a plethora of questions sent through for. I'd like to welcome to our Ask the Expert session today, Dr. Maree Cameron, a Senior Research Fellow at Nickham Health Research Institute at Western Sydney University and PhD student, and also a researcher along with Dr. Maree Cameron, Justin Sinclair. Thank you so much for joining me today.
Thanks. No problem, Sarah.
Now, the topic that we're going to be covering today is that of medicinal marijuana or medical cannabis, whatever you want to file it under. It's one that plenty of people have lots of questions about, and how effective it is for helping those people manage their symptoms and flare-ups with endometriosis. So either one of you can take it away. Do you want to talk about the difference, I think the key one here, between CBD and THC?
Yeah, so look, I think we'll let Justin take that. Justin's PhD, just to give him a little bit of context, is actually specifically on medicinal cannabis for endometriosis. So he is very much the expert in this. I'll let him take the lead, and if there's anything I can add, I'll jump in.
Thanks, Mike. So yeah, it is an interesting question. It's one that comes up quite a bit. So one thing to make clear is that CBD or cannabidiol and THC or delta-9 tetrahydrocannabinol are just two of over 144 cannabinoids that have been identified in cannabis. Now, CBD oil, of course, has gotten a fair bit of media attention recently. And one thing I want to make really clear, though, is that there seems to be a myth going out there that CBD is perhaps the medicinal aspect of cannabis and that THC is really only used illicitly, and that nothing could be further from the truth. So THC, even though it is the active constituent within cannabis that is around not only its analgesic effect or its pain relieving effect, but also that kind of intoxicating effect that it is, it's also very useful for things like chronic pain. So the idea that you use THC and that you would always get intoxicated or high really boils down to dose. CBD, on the other hand, is a non-intoxicating cannabinoid. Very, very interesting research coming out about it, for its anti-inflammatory effect, and obviously it also has an analgesic activity. And what you generally find in Australia is that you can have CBD-rich products that are very high in CBD and low in THC. You can get the opposite of that, which is products that are predominantly THC and low CBD. But the ones that are prescribed mostly, particularly for chronic pain, not necessarily endometriosis, but chronic pain in general, are what they call balanced products. And that's where you have generally equal amounts of both THC and CBD. So I think when it comes down to it, is that it's going to be it's going to be individual for the patient, depending on the symptoms that they're presenting with and how severe the pain and other associated symptoms are of their endometriosis, and also the way that their endocannabinoid system, which is an entire neuromodulatory system that we have in our body, which we'd know nothing about if it wasn't for research into cannabis, and how that actually works. So we're all slightly different. And so you'll find what might work for some women for their endometriosis might not work for others.
I think that would be the case for a lot of the treatments that would be prescribed to not just endometriosis sufferers, but anybody. You know, everybody's got the secret diet and the best workout tips. So as always, it's horses for courses. Now, when we're talking specifically with endometriosis here, what data do we have to work with?
Not much is the answer. Really, so some of the work that Justin and I have done is mostly been looking at what women in the community already tell us they're doing. And so we've got data from Australia and from New Zealand. And most of the women, or we assume almost all of the women in Australia and definitely all of the women in New Zealand were using illicit cannabis. So illicit, unless, they haven't been getting it through medical channels. And so they self-report that this really does help their pain. And it also helps other symptoms like gastrointestinal issues. Obviously we don't say it in our academic manuscripts, but, endo belly, I guess, digestive problems, nausea, bloating, sleep issues, whether that's associated with pain or something else, and also mood, women with endometriosis often have, some mood disorders, like many women or many people with chronic pain. So we've got this self-reported data. The problem we don't know, and comes back to what Justin was saying before, is we don't really know what they're taking. If you go and buy, basically a bag of weed, you don't generally know how much THC is in it, how much CBD is in it. And I think Justin will correct me if I'm wrong, but obviously historically, when you've been wanting to buy cannabis, you've been wanting mostly to use it to get high. So a lot of the strains have a high THC count, or high THC percentage, which might be great for pain. But obviously, one of the issues that is coming up as we talk about this more is impairment. So this is something that we see in the community, is definitely women are saying, yes, it's great, it helps my pain, it helps my symptoms, it helps my sleep. But one of the things we don't really know is, are they over-medicating in a sense? Do we not need that much THC to get the great pain relief? And so then you can still drive, you can still go to work, you can still not, if you've got child caring responsibilities, all these things that we know people have told us that they're worried about. And I'd say, one of the potential issues, especially for something like CBD, uptake is much greater than the research that we have to support its use. So it's very popular, but actually when you try and dig into it as a researcher, there's not as much there to support the claims in humans, especially. And I don't know, Justin, is that fair?
Yeah, that's a very fair statement. I think just getting back to what you were talking about, particularly when it comes to THC, is the driving, because that is something, as you said, that a lot of women that we've spoken to through focus groups and otherwise are concerned about, because it's very odd, is that Australia, actually yesterday was the 5-year anniversary of medicinal cannabis being legal in Australia. And the driving laws have not changed. So there is still the potential that you could be legally, medically prescribed medicinal cannabis by your doctor, and that if you had your tongue swabbed at a mobile drug test, that you would potentially be charged. So there really does need to be a push, federally and by the states as well, to look at these laws, because the problem is it's detecting presence of THC at a very, very low amount, and it's not actually detecting impairment at all. It's nothing like a blood alcohol reader where, 0.05, we know that's you're going to be impaired over that. All this test does is test for presence. And so there really does need to be some more robust research and hopefully some legislative change around that to protect women for what is now or anyone using cannabis for chronic pain or anything else, for what is now a medically prescribed medicine.
Absolutely, that is a deterrent for EndoWarriors and then other people who might be prescribed it as well, and also those people who have to give urine samples for work, and that they need to be clear as well. As you say, they are being prescribed and it is all above board and all legal, but the laws haven't changed. So definitely a deterrent there. So there's clearly a lot of work that needs to be done. Now, for somebody who is actually considering having this conversation with their general practitioner, and I know that this would vary from state to state with the laws that are available, but how does one go to their GP and start that process to see if they qualify, can they get it, what states can and can't get medicinal marijuana or cannabis?
Yeah, look, that is a very great question. It's one that we get all the time. And I think the important thing to state from the get-go is that any medical practitioner in Australia can prescribe medicinal cannabis. So it's not like they have to be a specialist or anything like that. A GP, specialist doctors, they can all prescribe. The way that they prescribe is through what's called, two main ways: the Special Access Scheme, Category B, or they're a authorized prescriber. Now, essentially all that means is it's not as simple as going to your doctor and they write a script and you go to the chemist. So what really happens is that they need to make sure that medicinal cannabis might be right for you, that you've maybe had, poor outcomes with some of the other types of more orthodox medicines that have been tried, and then they can submit a form. And that form is all done electronically. It goes down to the TGA down in Canberra, and they approve it if the form's been filled out correctly. And then from there, it goes to state approval. And then literally you get told which pharmacy to go and pick up your prescription from. So it's certainly not, it's something that can take sometimes a couple of days to maybe a week to actually occur. And I guess one of the challenges that we have also at the moment with the medicinal cannabis products in Australia is their cost. Is that the cost for these products, because they are quality assured, they are standardized, and that's just a fancy word to make sure that every single time a batch is made, you've got a standardized level of THC or CBD every single time. And it's also quality assured for, things that are harmful. So it's checked for things like ochratoxin, aflatoxins, heavy metals, pesticide residues, all those kinds of things. There's actually a specific therapeutic goods order just for medicinal cannabis products. So you can rest assured at least that it's a very safe product and it is quality assured. And I think that, at the end of the day, most people would like to know that what they're taking is safe. I know many women that have now gone down that path of legal prescription. On the other hand, there is the recent news about, which many people have probably seen in the media, about CBD oil being available at your pharmacy. And that's, so can you just go down to your pharmacy and get this now for something like endometriosis? And the answer is no. And there's a couple of reasons behind that. Number one is that they're still, trying to work out what kind of conditions can a pharmacist prescribe for. And I think it's fair to say that something like endometriosis, which is a chronic health condition, is maybe not best managed by a pharmacist. It's probably best managed by your specialist doctors. And so I don't think that that's probably the best way that things will go forward. We might see the legislation change over time, but at the moment, the best recommendation would be to make sure that you're seeing your doctor, because there are, particularly with CBD oil, there are some interactions that can happen with other medicines. And so that's important for your doctor to be aware of.
Yeah, for sure. As with any medication that is prescribed to you, without a doubt, just to double check that it's not going to interfere with anything else. Now, we did touch on very briefly before about, getting a roadside test and the THC coming up and that effect of having, this is legally prescribed to you. A lot of people question, how does it feel in comparison to another strong pain relief? Because a lot of endo warriors get prescribed some very strong medication, and that medication, can definitely relieve pain, but you read the backs of them and it'll say, do not operate heavy machinery, or you are not driving. And I myself know that some of the medications that I've been prescribed, I was not doing anything. I was just on the couch because I was not fit to go anywhere, let alone work or drive. So what is the comparison with having CBD or THC?
So that's a great question. And as a matter of fact, it is one that we're about to start a research project on. Justin and I have a student who's about to start working on a project which encompasses this, because you're exactly right. I had my gallbladder removed a few years ago. They gave me Endone for the post-operative pain, and I definitely was not going to be driving. I was pretty I mean, that's really what it was. I was, but one of the things that Justin and I have talked about is it's bizarre. So I can take that and I can drive, and it's legal. Even if I'm impaired, it's legal. Medicinal cannabis is treated separately, differently, despite the fact that it is also, as Justin mentioned, if you buy medicinal cannabis, it's quality controlled. The amount of THC and CBD is controlled. This is the same kind of process that goes into making endo. You know, you have the certain amount, you take it. But it's been treated differently, and that's probably due to the long-standing stigma of cannabis as, you know, a recreational drug rather than a medical one. So hopefully that will change. But one of the things that we agree with, and we'd really, you know, something we really want to look at is we expect that things like endo, like Valium, other benzodiazepines, all these medications that we know women with endometriosis are being prescribed, they do impair, you know, and so one of the things that we are also interested in, and we haven't touched on it yet, is this idea of the substitution effect, which is something which is really interesting. And that's just a fancy academic way of basically saying when people use cannabis, they tend to use less opioids or other medications. So we found that, you know, when women reported using cannabis for their endometriosis, they use less opioids, they use less benzodiazepines, they use less other drugs. And so considering the addictive potential of some of these, especially something like long-term benzodiazepine usage, you know, that's something which is very, not just the impairment that they cause, but, you know, we're hoping that, you know, this would allow women to reduce those other medications. And in theory, that really should be healthier.
Now, there's been a couple of anonymous questions that were sent through asking about the use for oils such as this for a long-term usage versus those short-term endo flare-ups, bursts, whatever you want to call it. How effective can these oils be at treating those two types of pains, which, you know, those suffering with endo are constantly trying to combat, because we do have one thing that we use for long-term and the thing that we go to when we're having a really bad day or week.
Yeah, look, it is a important point. One thing I guess to raise just from the get-go is that there's multiple ways that you can take cannabis. So for the majority of the survey work that Mike and I have done previously, looking at illicit cannabis use, predominantly most of the people were inhaling it. So, you know, smoking it or vaporizing it. And the interesting thing about the cannabinoids and terpenes in cannabis, terpenes are just a fancy name for essential oils. They're what gives cannabis its smell, but they are therapeutic. And they have a much faster onset of action when it's inhaled. So you inhale it, usually within 5 minutes, it starts to have an effect. And it, in some ways, would allow people to adjust their dose so that they're like, okay, I can feel the pain subsiding, I don't need any more. Whereas the oils, on the other hand, because you're ingesting them, they have to go through a little bit of a process, you know, with absorption and the liver and all those types of things, and they take a little bit longer. So that can take anywhere between 30 minutes to sometimes 2 hours before it comes into effect. But the difference between the two, which is a really good point, is that inhaled forms generally will only last for about 2 to 3 hours for their therapeutic efficacy, whereas the oils, when you ingest them, they can last anywhere between 6 to 8 hours. And so there's this, obviously, if you can keep the oil levels at a level so that they don't dip too badly so that you can experience the pain again, you should be able to get doses that you know, coverage, if you will, throughout the day. And particularly for sleep, it could be quite important, because if the pain's waking you up, you could take an oil at night and that should be able to cover you through that pain management. But yeah, it's an important thing when it comes to the dose. The dose is so important. The dose, when it's titrated properly for the patient, you should have some pain relief, and you shouldn't necessarily feel high or intoxicated. So I've spoken with many chronic pain patients over the years, and once they get that dialed in, that's exactly what they report. They report that they experience that pain relief, but they don't necessarily feel high. So yeah, that's a good point to make.
I guess that's the same as if you're being prescribed Endone or Valium or something else. You're finding the dose that works for you. And that's going to take its time, especially if you're new to it. Now, one of the other questions that we got sent through from Jade was asking, do we have any studies or evidence about any effects that this may have on the brain after long-term use?
So on medicinal cannabis that I'm aware of, so when we look at medicinal cannabis, because it's, the research for it has largely been stifled for the past 90 years, but it's picking up at a pretty serious pace now. There are obviously a lot of studies from illicit cannabis that are suggesting that, long-term use could cause problems for a developing brain, particularly. So in the very young, usually a lot of doctors would advise, no cannabis use before mid-20s, simply because of brain development and things like that. But the one thing that a lot of those studies don't take into account is that they were looking at this data retrospectively and not actually looking at the products that was prescribed. So were there any contaminants in there? Were there any adulterants? Could that change the outcome? And the answer is probably yes. So we do need to look at longer term studies when it comes to safety for standardized quality assured medicinal cannabis products, but specifically also in the endometriosis population, there's been no clinical studies to this date that I'm aware of.
So really, it's such early days that it's hard to tell, and we don't have enough studies with this, so it is kind of a wait and see, but for now, still very safe for people to have prescribed.
I think that's fair to say, as long as they're under the care of, a medical practitioner. And there are obviously some things that probably you need to be a little, cautious over. So if you had a history of schizophrenia or, mental health conditions in your family, or you already have that kind of presenting, then there has been some studies that suggest that cannabis could potentially unmask some of that. But again, if you're with a doctor that's taking care of you, that's going to be all part of the questions that they're going to ask. And it's certainly part of the questions that we have to ask when we look at recruiting for clinical trials.
Here's a question, and perhaps this might help some of our endo community put the hard word on some members of Parliament. What do we need from the Australian government, be it at a federal or state level, so that we can get more of these studies?
Money. No, I mean, I know it sounds very glib, but we need funding, obviously the federal government has released some money for endometriosis, which is fantastic. But if you look at how much money dementia gets, for example, diabetes, heart disease, they have similar cost of illness burdens to endometriosis. Our research found it was $9 billion, well, actually 9.7 billion Australian dollars a year. There's a similar burdens to other really serious diseases, and endometriosis gets a fraction of the funding. And it's hard. It's hard for us to build big trials. It's hard for us to recruit. It's hard for us to do a lot of the work we need to, because there's only so much if you don't have money, you're really limited to what you can do. And we just need more. We need more targeted support. Dementia, my friend who is a dementia researcher has many chances each year to go for dementia funding. There's all these different dementia grants, NHMRC dementia fellowships. We need something like that for endometriosis and pelvic pain. We need the support. We need more funding. We need more career opportunities to bring on young researchers, and mentor them. We just need it to be taken seriously. I think that's the main thing, is that, we can do these reports, we can write about how much it impacts women, but to make a difference, we need to run clinical trials on things like medicinal cannabis, and that costs money, and we need salaries and to be able to pay for our research assistants and all of that. So we just need the support.
And when we've got studies showing that Australia is unfortunately ahead of the rest of the world, where a lot of countries have 1 in 10 people suffering from endometriosis, we have 1 in 9. So we've got even more sufferers here in Australia, and yet we don't have anywhere near as much funding as what this deserves for how common, because it's common.
Yeah, it's not only is it common, but it's just, the impact, as I can only speak to it from the outside. But when we do this research and I write these papers, it's awful. It's awful.
Yeah.
And there's literally not an area that I can think of that is not negatively impacted in women's lives. And so, not only is it common, it's just, we've got to, if we had great treatments already and, this was something that could be managed really well, it's common, but you can take a pill and it's, that would be very different. But we're not currently able to manage it that well for many women. So, that's where we really need to be looking. How do we shorten that time to diagnosis? How do we reduce the impact? How do we, stop it happening?
Before we wrap this up, can either of you recommend perhaps any websites that people could go and have a look at, because I know that many people would be interested in doing some more reading, perhaps some studies or countries that we can look at while we wait for Australia to catch up?
Yeah, there's actually a, for those that are interested in medicinal cannabis in general, there's a website for a charity, registered charity called United in Compassion. So United in Compassion was founded by Lucy Haslam, who was the mother of Dan Haslam, who was the one that really started lobbying for medicinal cannabis in Australia. So on the United in Compassion website, if you sign up and you can access, I think it's over 50 different videos from world leading experts talking about everything from, cannabis use in cancer all the way through to the endocannabinoid system. And I think there's a video of me on there talking about endometriosis, but there's, apart from that, not much on endo, unfortunately. But yeah, particularly for those that are just interested in learning more about cannabis and the endocannabinoid system and how it works in the body, that's a free resource that they could access.
Well, Mike, Justin, it has been an absolute pleasure to speak with you. This is a topic that so many people are going to continue to have many questions on for a long time to come. But I think you've sparked enough interest right now, and I hope that plenty of people go and, do some online searches and hit up their local members of parliament and keep campaigning and spreading that awareness. Thank you both so much for everything that you do in this field. As an endo warrior myself, I'm very thankful.
Thanks, Sarah.
Thanks, Sarah.
And if you would like any more information or you would like to donate, endometriosisaustralia.org. We appreciate you jumping on board and supporting Endometriosis Awareness Month any way that you can by checking out these Ask the Experts sessions that we've got, maybe by wearing some yellow, hosting a high tea, or you might want to listen to the Living with Endo podcast with the wonderful Ellie Angel Mobbs, who is another ambassador with Endometriosis Australia. You can grab the links for that at endometriosisaustralia.org.